3 things that are stressful, maybe the most stressful from like an emotional, mental,
Look at that, I can count.
kind of,
Thank you. Three. Well, you're a big boy, you can count.
they are stuck together because they're,
Seven.
thank you.
I was just like, I'm just like, I'm trying to
Okay, so I'm gonna go along here, do ya?
stop that. Stop it. I'm like, oh,
Just tell me what to say.
Things that are stressful.
Is that what we're on? I told you I didn't know how to count.
Really, for sure. You have to do one more.
Part four.
That's 100%.
Number four is not being able to count. You take it as 5.
no, you need to get 3.
Sicko up there.
I'm sorry. I didn't ask for this.
Kids mask it for.
No, I drew it. I colored on it because I'm 5.
I understand.
I saw you guys sitting on that bridge, I'm like, I released them forever ago.
Yeah, we're blocking traffic.
Like it was there the whole time.
No, I he's up at Riverdale, is going sideways. That's all we need?
It's hard to wind up.
No, I have made sure block because I'm adjusted.
Straight paint.
I don't know about that, it'll be an hour, I'm happy to.
It says
Whatever you need to do.
1.5 once. Roxanne.
Oh, Jesus Christ, yeah, okay, here we go. Oh, I wrote my name.
Okay, what do we do with these when we're done?
Right here, put them in this bag. I'll go around, Mark.
That's some black.
Well, the worst part is.
Actually, it was this.
I wrote down a lot.
It only took how many?
So good.
I can make that out.
Right back.
Well, you're always.
Oh, there.
Wait, no, I got a good one.
No change. A lot of consistency.
I hate to be the only one.
Is this, don't come back on the front?
Like, I'm confused.
Like approved or accepted?
I don't
That
know.
looks really good.
Oh, nice. Is this like just?
Did you track that?
EMS, so the EMT, that's the test. They said that they were changing us.
I'm sure David can touch that right up.
But now I'm confused. Easy there, Chick-fil-A.
call the doctor?
No.
Good morning, everybody. How are you guys doing? Good morning.
Good morning.
Like you ran 10 transfers after 10 o'clock last night or
We
something?
had one rough night.
I didn't even get to see the Super Bowl. I mean, I was so disappointed.
You and half the country.
Like to welcome you. I'm super excited. This one was one that I was way excited. I got Dr. Summer Grace. Kelsey actually helped me get her. So she's here to talk about mental
Health and
Health
wellness.
and wellness.
Yeah, everyone's most favorite topic ever.
Yes, most favorite. And then after she talks, we'll talk about our peer support program. Cap on it. Okay, I'm not gonna say anything.
No, you're good. It's all good. Okay. Awesome. Okay, so my whole goal is that this is like kind of a discussion. I'm the discussion leader. I really don't want to just lecture. So I'm hoping, I mean, you guys are all chatty, but this is what happens when a lecture starts. Everyone's quiet and then nobody wants to participate. So we're gonna have to remedy that, but.
Won't be a problem.
Okay, no, that's good. I like it. So, like I said, probably not everyone's favorite topic. So I work with a couple fire departments. I work with Riverdale and South Weaver Fire. And I do a newsletter for them quarterly. And last year I did a newsletter. It was kind of as we were coming out of COVID. And so I think we were just all really feeling it. Some of us probably are still feeling it quite a lot. I feel like our kids are really feeling everything that they went through with COVID. I feel like we're seeing a lot more anxiety and depression in our youth for sure. But we kind of are this special niche of people that kind of dealt with COVID in a different way, saw a different side of things. And so I felt like this was somewhat appropriate. But anyway. Okay, so like I said, we're going to start talking. So to get everybody talking, we're going to start with a couple questions just because it's a good way to start.
Dr. Grace, I'm gonna change your light.
Okay.
lighting there.
And I have no idea if I'm on your video right here.
Oh, you're
No,
there.
is that
You're
fine?
on it.
Okay,
Yep,
fantastic.
I got you.
Okay, so everyone just read through that and then you can shout out what you think the answer is. What's the answer? See, everyone's quiet. Have you not read the question yet?
B.
B, okay. So after a call, do you feel like you can process things with your crew? Do you feel like there's an atmosphere of openness and being able to discuss, hey, do you think this was the right call? Do you think this was the wrong call? Do you guys feel that in your department and your crews? Okay, that's good. Okay, so here's another question. So shout out an answer if you.
Geez, probably A.
Okay.
It could be C. Maybe some B.
Who says B or C? Make an argument.
B.
Okay. Someone saying B. Anyone want to make an argument for one of those answers?
I think you could do A or B.
Okay.
An acute stress reaction, in my opinion, could be from a lot of different things. It could be from the previous call. It could be a lead up of things. And you might normally not react like that. It's just the circumstances you're presented with. And then
Sure.
It could be A, because it's been a long time coming and you had started treating a lot more people like that.
Yeah.
I think the ugliest one up there is probably A, and I think that's the one that no one wants to admit to.
For sure.
It's more than likely probably what the issue is.
And that's the official answer to this question is A. But you're right, it is kind of the ugliest one up there, and none of us really want to talk about it. None of us want to address it, which is why we don't like talking about this kind of stuff. Just generally, it's hard. Okay, one last question. And then shout out an answer. So I like this one. I mean, I feel like we all have to have some ideas, and we're gonna talk about some ideas on what to do to sort of decompress that stress, not only, you know, on a regular basis, but even in the moment. I remember having a partner, we were on a really stressful call, this was years ago, and his kind of go-to was to whistle. And I was like, we're dealing with this really sick patient, and my partner's whistling. What the hell? But that was his, like, you know, de-stress in that moment kind of go-to thing. So anyway. So today we're going to talk about kind of the good, the bad, and the ugly, not necessarily in that order, but just generally of wellness. And you can see it gets pretty ugly. So why do we need to talk about this? So these are just some articles that I found that were just, I mean, easy. You just put it in the internet, and I mean, you get a whole slew of information coming up about, you know, this phenomenon of EMS burnout and the effects that it has on our life. We know that it's real. I don't know how much research has really been done to figure out how can we combat this. There's certainly some, but not as much as we probably need or would like. So I really liked this statistic and this graph. So this came from the CDC, and this was done in 2012. So if you look at this, I mean, this is pretty disturbing. You know, EMS, we're at a higher rate of stress and suicide contemplation and attempts. And this, like I said, this was 2012. Do you think it's better or do you think it's worse in 2023?
Worse.
Totally agree. So you might think, well, that's a national survey. We're pretty happy people in Utah, and I agree. Well, I don't know. How many site transfers did you take last night? Did anyone participate in this?
Yeah.
Yeah? Did you see the outcome? Did you ever see the results? Okay, cool. So this was a survey that they sent out. There were 364 people that responded. I didn't see the makeup of departments. They actually didn't publish that information. But we're just going to go through this because I think it's really interesting. So we have a lot of really young people in the field, people that have been in between 5 to 15 years. You know, that's kind of the general makeup. That's what, 45%. One of the things that, as I was kind of studying on wellness, is that, you know, I'm just going to ask, how many people here are less than 25? Okay, younger. So your brain,
Years
yeah,
or-
25 years old, I'm sorry. Yeah, so some for sure. So your brain isn't fully developed until you're 25 above. You're still making all those neuronal connections. And so people that are younger than 25 actually have increased stress in some ways because of that. Anyway, just more vulnerable population, like I said, with we're seeing with our youth as well. So maybe answer these questions in your own mind and look kind of where do you compare with the average here in Utah. Can you guys see those things? No. That's the people that are over 25 that cannot see those things. So,
Why do you think I sit in the front row?
right. So 74%, I'm just going to point out the really big ones. Disruption of sleep or insomnia, 74%. Easily angered, 61%. Feeling emotionally numb, 62%. So those are the big ones there. We're going to talk about feeling emotionally numb in a little bit and what that means. Is this stuff, do you feel like this is surprising, or you're like, yeah, I know this, I live this, this is my life? Oh, sorry, did you want to take a picture of that?
Oh. Yeah, I was waiting on me.
So you can go home and tell your spouses, look, I'm normal, I can't sleep, and I am super angry, and I drink a lot. I'm totally normal. Okay, so how would you answer that? Do you feel like that's true? Are there adequate resources?
Yeah.
Yeah, some people say yeah.
Yeah, I think it's true. I think that just being in this particular career, I believe that we feel like we're above needing that. To be
Because
honest
why?
with you.
Why do you think that is?
Well, I think that we have to internalize a lot of it, and because we can't or shouldn't, not that we necessarily can, but maybe sometimes we feel like we shouldn't spread that because we have to go out and see things that normal people should never have to see, and we have to deal with that.
Mm-hmm.
And so for us to maintain that expectation through the public's eyes,
Sure.
we need to develop a hardened core.
Do you think there's that same stigma throughout your own community? That you have to be tough, that you have to be, you know, you can't let this stuff affect you? Yeah, I agree. A lot of people saying, yeah.
I think this is kind of disguised. I think, is the best way I can describe it. I think like, everyone knows that, okay, we can go make an appointment with like Bloomquist, and the initial contact to speak with someone is actually readily available.
Mhm.
It's there. But to continue on past that, or something that requires something a long-term, or, I don't think it's there at all. I really don't.
So you have some short-term resources.
And I think that's true with all of society. Short-term, initial contact, being able to talk to someone is fine, but when it's comes time to set up, you know, well, what further therapies are, there's so many different therapies out there that can be beneficial that just are not gonna be made available in a timely manner, or because it's just not possible with the population, you know, or
Yeah.
the benefits that you're, whether it be available or allowed for the time to do it.
Sure,
I don't think it's there at all.
go ahead.
Piggyback on Pat, that's really good. I agree that service is available, but again, going past the initial, we're so different in what we experience and what we have to deal with,
Mhm.
that finding that right person
Mhm.
is damn near impossible,
Sure.
that you will listen to.
It's very hard to find someone in psychology that's, specifies in trauma, you know. or-
Mhm.
There's not many. There's a
Sure.
lot of other specialties out there,
Mhm.
but not a lot of, that specify in trauma.
Trauma the way that you guys see it, maybe personal trauma, things of abuse, because there's a lot, I would say, that probably deal with that sort of thing, but the trauma that you guys see and deal with is definitely different.
Yeah,
I agree.
and what it really comes down to, and this is from, you know, my wife deals in mental health and
Mhm.
side and patients and things like that. On that side of it, you have to actually, in a lot of cases, and I'm pretty sure this is gonna be true with most of us in this room, you have to go to a certain amount of therapy sessions before you can actually find the correct treatment. You know, there are people that will attend, and a lot of good therapists out there will insist that you go for at least 6 months to a year to fully caulk and get through all your stuff before they prescribe what type of treatment is going to help you.
Mhm. Gotcha.
Whether it's some type of immersive or,
Mhm.
you know.
Okay. Good. So I'll let you answer that for yourself. But if you have, you're not alone. So this is kind of interesting. You know, our resources are limited. You guys live that maybe on a personal level, but also you live that on a I'm up all night doing psych transfers level. And it's because our resources are really scant, you know, and especially for adolescents. So sometimes we turn our family members into de facto therapists. I mean, I talk to a lot of people about trying to get into therapy or finding someone in your life that you can talk to. My poor mother is like my therapist. She's an unbiased ear who loves me and is kind, but also gives really good advice. I actually called my brother the other day to vent to him about something, and he ended up yelling back at me, and I was like, whoa, not gonna call you with my problems. So, you know, sometimes it's tricky trying to find someone who can listen to you, who can relate. My dad was a cop, and so my mom kind of is a good listening ear because she kind of listened to a lot of these stories as she was raising kids and stuff too. So anyway, all right. So I kind of asked this a little bit, you know, can you have an open conversation with your colleagues, but not necessarily about mental health issues. So sometimes we process a call, you know, hey, you know, what would you have done? Do you think this was the right thing? But are we as willing to talk about our mental health and wellness issues as we are kind of clinical care sort of issues with our crew. Do you guys feel comfortable talking about that?
I think the two commingle. We take a lot of time on micro, I think everybody does, you know, after the simple call, you know, hey, let's look at this, maybe if we'd done this, you know, it would have run a little bit smoother, what about this? And then on the really difficult ones, we'd spend a lot of time on that, and just, I think it's important that everyone has a voice, and everyone is able to equally share the positives, the negatives, their frustrations, their triumphs, and those things, and so I think they work together.
Good.
In my opinion, on hey, can we learn from this, and how is it affecting you this way, and you know, let's check up on each other throughout this and make sure everybody's managing it. Well, I think that's a really important thing for us.
Good. Hopefully everyone shares your feelings on that. I won't ask, but. It sounds like Will's gonna talk a little bit about resources specific to your department in just a little bit too. So this is good. So this slide and the next are pretty startling. If we figure there's maybe 20-ish people in here, I mean 17% of 20, 15%'s 3. So there's 3 people possibly, maybe a little bit more, 3 to 4, that have had thoughts of suicide in our group here. I mean, that's startling, chilling. And then attempts. So this isn't, if we go back to our 20 analogy, this is less than a person, but still, I mean, if you contemplate, you know, in the course of the whole department, you know, how many people have maybe attempted suicide, whether you know or don't know. Okay. I thought about having us raise our hands and see how many people not only know one, but how many people do you know? I mean, I probably could list 5 personally that I knew that have taken their own life. And that's so hard. Because it affects us, for sure. All right, so health and wellness, these always go together. Today we're really gonna focus on wellness. Health is a state of body. I'm a physician, but I'm not gonna tell you how to be healthy physically. Like, I feel like you guys know this. You guys have to be in shape because of your jobs. You're firemen and women. You probably eat well. You guys are good cooks, right? You eat healthy. So that's the stigma that we're then. So wellness is a state of being. What's a state of being? Anybody have any ideas?
A mix of like your emotions and feelings and.
It's like the touchy-feely
Yeah.
stuff, right? It's like not the physical, it's the touchy-feely. Okay, so we're gonna define it here. So all of these things play into your self-wellness. And if you think about it like spokes on a wheel, we need to stay balanced. We need to have all of those things in check so that we can roll along and do our thing and be healthy. When those things get out of balance, you know, some we spend extra time on. You know, some of us are more worried about our social life. Some of us, that would be my 21-year-old. Who can't do anything else. And then, you know, some of us are not spending time in spots where we need to be. So today we're really going to just talk about, you know, on this wheel, you know, mental, emotional kind of area. So here's a definition. Will somebody read that? Anybody?
A state of being is a quality of your present experience. Emotional experiences aren't achievements because they fluctuate over time. You can be happy right now and upset an hour from now. Accordingly, being happy is not an achievement, it's a quality of your present experience.
Okay. So this is from Tony Robbins. You guys know who Tony Robbins is? Did you ever see Shallow Hal?
Banana hands?
He was like the guy in Shallow Hal that was like the motivational speaker, life coach guy. That was Tony Robbins. So, and that's what he really does. That's his claim to fame, is he's, you know, developed all of these, you know, life coaching strategies and things like that. So, so he talks about 2 states of being. So there's beautiful states and suffering states. I don't know what you think about those words. I definitely like the ones on the left a lot more. Sadly, I dabble in the ones on the right more often than I should. But it's always a battle trying to get back over to the left. So this is something I always try to teach my kids. It's not what happens to you, but how you react to it that matters. And what I like about that is that it implies that there's a choice. So between what's on the left and the right, it really is a choice. We can choose to be angered, we can choose to be happy and optimistic, or we can choose to be a pessimist, to be negative all the time. It's truly a choice. Now, all of these things that are around us influence our choices for sure, and sometimes it's hard to make that choice. It's like peer pressure, sometimes you've got the world crashing in on you and you're still trying to choose optimism. That's hard, but it's a choice. So you need to replace a default state of pessimism or anger with one of determination, of will, of generosity, of curiosity, of gratitude. The more we can put ourselves in such beautiful states rather than suffering states, the more they become habits of being, and we end up making better decisions. And that's true not only about life, but they've actually shown that this is true about the decisions that you make when you're providing patient care too. So making better decisions for your patients, which is good. And the formatting on this, I had to import it into PowerPoint, so sorry about that.
I
Yeah.
agree with this a lot because I think what people in society are lacking a lot of is conviction, in the sense that so many people like just read social media and look up a bunch of thoughts on, a lot of the impressions on Google about, well, what's wrong with me? And they'll find all these symptoms and then they're like, oh, well, this is the answer, I'm not, this is what's wrong with me. People want to be labeled as to, well, this is what's wrong with me.
Mm-hmm.
And so they use that as an excuse, when in reality, if they just had some fortitude and conviction, believe
Sure.
that, a lot of this can be a state of mind in the sense that if you just had enough mental strength, you didn't succumb to what other people thought was wrong with you and adopting that so quickly, you
Yeah.
actually have a stronger resolve to get through and work through most of your problems rather than just, well, I'm broken.
Sure.
You
During the pandemic, I feel like we're all burnt out. I definitely was feeling it. I had a colleague who through all of it, he just made a decision, literally a decision one day, and he came in and his whole attitude was changed. It was bizarre. I was like, how did you do that? But he just said, I'm just not gonna get mad anymore at work. I'm just gonna come, I'm gonna do my job, I'm gonna be happy about it, I'm gonna be, grateful. And it was like a switch, where one day he was kind of grumbling and the next day he wasn't. And I don't know how he flipped that, because I think it's a choice we have to make, not just once, we have to make that choice every day. Every day as we're faced with different problems, it's a continual choice that we make, so.
Do you know what prescription he started?
I know, right? That's a good question. I should probably ask him. So I like this. I talked to a lot of people. I feel like life is for sure a roller coaster. And I love this idea. Although when I'm enjoying the ride, I do scream because I just like roller coasters and I think it's fun. But anyone have an idea or an example that they want to give of something, like work related maybe that was really up or really down?
It's funny, because years ago, I love the roller coaster thing. I used to sit in our officers' meetings, and if they start yelling at us, I'd start doing this.
Oh, boy.
And
they were like,
they're
what
are
are you
doing? I'm like,
doing?
just enjoy the roller coaster
You're like, this
ride.
is not a Southern Baptist church. We are not standing and
Yeah.
that's hilarious. So one thing that I think of, people ask me about my job, and I think our jobs are pretty dang similar. But the best way that I can sum up my job, one day I had this shift. It was pretty crazy. I walked into this room. It was over in the psych hall. You know the hall I'm talking about at Davis. And
That hall.
yeah, that hall. Anyway, and I walked in, and I'm pretty sure this lady was hitting on me, the patient. But she was there for psych reasons. And then I left the room, came back 20 minutes later, and she, I was an F&B, I was blah, blah, blah. That is the definition, just in case anyone wanted to know, of borderline personality disorder. To switch from one to the next like that. Anyway, so I had that. And then I had another patient over in like, I don't know, room 17 or 18, who was like a COPD or CHF patient. And I was getting ready to discharge her, and she starts spouting off about how she's gonna sue me because I'm not admitting her to the hospital, and I'm sending her home, and she's gonna die, and her family's gonna sue the heck out of me. And then I had this other lady who wants, I'm an F&B. And then in room 21, I had a patient who was an elderly man who was going downhill fast, and I had to start talking to his family about essentially comfort care. He's gonna die, end of life, what do you want us to do? And so to shift gears from all of those things, it was like that, and that's what we deal with. You might go on a call that's really trivial, that's a feel-good call. You helped a little lady off the floor, and she just wanted to talk your ear off, and she was lonely, and she just loved having you there, and you kind of feel good when you leave, to the call that I had the other day, that someone brought me, it was from Kaysville, I guess, but of a 17-year-old who drowned in a pool. Luckily, she's doing okay, but, that's our job, right? Ups and downs, and stark ups and downs. Highs are high and lows are low. So I like this cartoon. So I wanted to kind of see what some of your stressors are. And we can kind of talk about some of those real quick here. If I can read your writing. Okay.
Bunch of third graders.
So meeting the needs of my crew. So these are some of the stressors that you guys have. Being away from home. Wanting to add value to my team. Worry that this person doesn't add value to their team. Fear that it'll worsen my mental health issues, existing mental health issues. Inexperience. So these are all things that are kind of up there too, I would say. Hard to fall asleep at work. Do you guys just have tones, or how do you get your calls? Just tones?
Lights and tones.
What's that?
Lights and tones.
Lights and tones, okay. I don't know what that one says, sorry. Teammates depend on me. Dealing with people's problems that I find stupid and minimal. I like the honesty. Being up all night. Just gonna read a few more. Sorry if I'm not reading yours. School. Meeting my own expectations. So these are all really valid, and probably if I read all of those, we're gonna see themes, that come out. Anyway. So harms of stress. So we know that if there's repetitive exposure to stress, that you're going to have problems. So some of these are physical, and I said we're not going to talk about a lot of physical stuff, but we know that that's true. Cardiovascular disease, diabetes, and then anxiety and depression. Stress and burnout cause increased risk for medical errors, self-destructive behaviors, and often early retirement. So I have a colleague who retired not long ago, and when you ask him why he retired, this is why. I mean, it was the stress, it was the burnout. COVID really affected this person very strongly, and they went into counseling right after they retired just to get a little bit of extra help because it was just a lot. I asked a colleague of mine that retired a couple years ago, actually before the pandemic, I said, how in the world did you stay in this career for 25, 30 years? And he said, well, it didn't used to be like this. And I thought, well, that's reassuring, So it's really hard right now. All right. So workplace stresses aren't simply isolated to the workplace. They spill over into our personal relationships, our home lives, and our overall productivity. So this is me a long time ago trying to manage my work and family life. This was Christmas, and luckily I had a partner who was willing to come with me to my family's house because their house was in the district where my station was. And this is so old. These are two of my kids. I have three, but he's 26 and he's 21. So this was a long time ago, but anyway. And they're pulling super dorky faces and probably really embarrassed that I even showed these. But so in managing our work-life relationship, we know that it's hard on our marriages. when I go home and I try to talk to my husband, like we talked about earlier, you gotta find that person in your life that you can talk to. Mine is not my husband. I love him. We've been married for 25 years. It's been a roller coaster like everything else in life. But he is not who I talk to. Because I come home and he tells me, well, you know, why don't you just tell him to F off? And I'm like, seriously? Like, because that's the difference. Like, I will have a job for 15 more minutes, you know? But that's his solution to most things. Or just call me and I'll meet him in the parking lot after. And I'm like, seriously? Anyway, he's one of those negative, pessimistic people. It's kind of rough sometimes, to be honest. So divorce rates, kind of an older study again, but what I thought was really striking about this is just that it seems that women are affected more than men. More of you guys are married, and you definitely have a higher divorce rate than the general population, but women have a divorce rate that's 3 times what the general population is, which was, again, that's hard. So we all have needs. Some of them are basic needs, you know, even like sleep. Sleep falls under this category here. But ultimately, we all want to get to the top where we're achieving our full potential. But everything is based, you know, if we're not sleeping, which is the bottom of the pyramid, how are we going to reach our full potential? So we have to make sure that all of these needs are being met. I'm not going to tell you exactly how to do that, but I think it's important to recognize that, like, you can't meet your full potential if you're not taking care of yourself in all these other ways. You guys are just coming off. Well, so you're in the middle, right?
Yep.
Okay, in the middle.
With the meek face.
So you're like right in the middle of this. So tomorrow I'm lecturing, but you guys will be gone, but you'll look like that on your way home maybe.
Drilling on ourselves.
All right. So sometimes I get to work and I just tell my colleagues I'm feeling crispy today. It's like a spectrum. Like there's burnout, and at the other end of the spectrum is like you're like crispy, charbroiled, like almost blackened, you know, on this side. And sometimes I definitely feel like that. I had one shift out at Roy. I felt so bad. I got to work. I just warned everybody. I was like, you guys, this is where I'm at mentally, emotionally. And I bought pizza for everyone because I was like, you guys have to put up with me. So I'm going to buy pizza. And it actually ended up being like a really good shift because it kind of brought everybody together and it improved my mood that I could kind of help other people and, I don't know, do that, which was kind of nice. But so burnout is bad. And it does all these things. I mean, we talked about, you know, some of these things can affect your ability to make good decisions for your patient too. So I mean, we know that it affects bedside manner. I mean, were there some patients that you can think about in your past where you're like, wow, I just really didn't treat that patient very nice. I probably could have been nicer to that patient, you know. Or we just get frustrated with people. So this guy, Tom Mayer, is a physician. He's the medical director for the NFL. So he's the first and only medical director that the NFL's ever had. I figured this was appropriate since the Super Bowl was yesterday. But I like what he says. So really, burnout is our job stressors over our adaptive capacity or resiliency. And Pat, you said fortitude. I also like that word a lot. So if you think about an equation, if we decrease the top number and increase the bottom number, then that's how we make this equation look a little bit better. So he has a whole book that he wrote on this, but I like that. So 2 things we can do: decrease our job stressors, which isn't always in our control. Sometimes we can, but our ability to be resilient is the next best thing, I guess. So this MassLatch burnout inventory, it's an actual manual, and if you're interested in learning more about this, you can go to mindgarden.com. So that's where you find this. It's an actual manual where they go through and they have a survey and a scoring system to decide who is burnt out. This is something they've had like 3 iterations of this manual because they've done a ton of different research on it, and they've looked at different specialty groups. So there's like a health services group. But if you're interested in knowing if you're burnt out, there are a lot of tools for it, but this is kind of the leading group and kind of gold standard, I guess, if you will, of determining whether or not you have burnout. And it's individuals who work with people in some capacity. So it's not like vet techs that are burnt out because they're working with dogs, like people working with people essentially, and I guess they work with people too, but anyway. So our training is put patients first. I don't know if you guys feel like that's some of your training. So actually I got online last night and I was looking at your mission statement, and it talks a lot about how you're gonna serve the community. You're gonna provide education, you're gonna provide great fire service, you're gonna provide awesome medical care. But what about your employees? What about taking care of your own? I listened to a talk a week or two ago that talked about all good mission statements should have some sort of a reflection of how they take care of their people. That way, that you want to work there. It's when they look at the highest rated companies as far as being an employee, those companies tend to have some sort of, inclusion statement for their staff, which I thought was just kind of interesting. And I'm not coming down on your mission statement, but just kind of a shift in our thinking. None of us are taught to think like, worry about ourselves, except for, I would argue, BSI, my scene is safe. I would say that's probably, us first, and then we go to the patient, but otherwise it's kind of this. So I also like this. Anybody have any thoughts on this? Kind of explaining this analogy, even in the airplane.
I think it just falls under the whole, you can't pour from an empty cup.
Yeah.
So if you're struggling, just kind of what you hit on before, burnout, mental health, wear down can affect patient care. And so if we're not taking care of ourselves, we can't take care of our patients.
Yeah, totally. Okay. So we have to be able to recognize the warning signs in ourselves. This is kind of step number one to kind of identifying, where are you at, maybe on that spectrum of no burnout to crispy fried. And it's dynamic. We talked about ups and downs. Depending on the day, you may be in a different place. There are days that I talk to my sister and I'm like, ugh, today totally sucks. And then the next day I'm like, I'm better today. Life's a roller coaster. So these are some of the warning signs to kind of just check yourself. Do you have any of these? Some people in your crews here have said, sleep. Sleep is hard. Worrying that you're maybe not enough. We have something that we learn about in medical school called imposter syndrome. Where you worry, have you guys heard of this, imposter syndrome? You have, okay, I won't explain it, but I think that's real for all of us. Oh, sorry. Yeah, I made these slides in Keynote because I have a Mac and then I had to change it to a PowerPoint. It kind of changed my formatting, sorry. So we're all going to have different symptoms of stress. So step 2, we have to implement stress management strategies. So what works for me may be totally different for you guys. I've met so many people that are like, I go running 5 miles a day. And they're like, you should start running. And I'm like, ugh. And I'm like, no, you just have to run until you like it, until it feels good. And I'm like, yeah, who does that? Like, I'm sorry, some of you that are runners, like, I don't get it, I never will.
Sounds like a cult.
Yeah. I played sports in high school, I liked that kind of exercise, but like, Anyway. So they have this in one of at Roy in the break room. And I always like reading this when I'm at work. So you can't give up. We have to troubleshoot this. We have to figure out a way because your community needs you. You guys need each other. Our families need us, No pressure. So some practical ways to cope with stress. I'm kind of a practical person. I'm going to tell you what works for me. I would love to hear what works for you guys. And some of this is what works for me, some of it may be what works for my peers. But so talk it out. So I kind of talked to you about who the people are for me in my life that I can do this with. So live a balanced life. So in medical school, we had a psychologist that worked for the school, and she said, do something outside of medicine every day. Sometimes our lives are totally consumed with what we do for a living, which is super not healthy. And so find something every day. Even if it's, going into your sleep room and just reading a book, checking out for a minute, doing something for yourself. So have a laugh. when I was in school and I was stressed out, I took my family to Macaroni Grill. And I had just gotten back from Haiti, and I did the worst I'd ever done on any of my exams. It was OB-GYN. I think I was a little bit cocky as a woman. I was like, I know this stuff, I have kids. And it was for sure my worst score anyway, and I just was feeling super low, and I was like, let's go to dinner. So we, at that point, like, my kids were little. I hadn't taken them to very many, like, nice sit-down restaurants. It was like Chick-fil-A, usually, whatever. So we get out of the car, and I said, listen, this is a nice place. You guys need to be on your best behavior. So we get out of the car, a Macaroni Grill. We don't have any, it seems like. There's one in Murray now, and that's like the only one. But they have music that plays outside. So we pull up, we get out of the car, and my kids hear the music playing outside. And they're like, ooh, this is really nice. They're like, guys, we got to act like millionaires. That's what they said. I was like, what? So we sit down, and we're trying to order, and I've got 3 kids, and one is playing air guitar at the table. And my other one is in junior high, and he has like a home ec class, and he's like folding his napkin all special, like napkin folding at the table. It just was like looking around, it was like comedy of errors. It just was really funny, but it was like the most therapeutic thing I probably could have done to like deal with my post-test stress. Anyway, let's see. Anyone have any thoughts so far on this slide? We'll keep going, but. So work hard, rest hard. Everyone knows work hard, play hard. But sometimes we have to rest hard too. So I like Dr. Mayer says, we're like performance athletes. We have to perform, rest, and then recover. So it may not be that you hit it hard tomorrow when you get off shift in the morning. Like you might need to spend some time actually recovering and resting before you are fully functioning and can commit to whatever you need to do for your family or your, 2 other side jobs that you have or whatever.
I was gonna point out that it's one of the things that I try and encourage at least all the newer people that I speak to is, because in this job, we always end up having 2 jobs.
For sure.
Almost always. And I'm like, I tell everyone that I can, do anything but fire or medical. Just do something else that you might enjoy. Go, serve coffee. Don't go do something else.
I thought about
anything
that.
else.
I thought about being a barista or
always,
flower
we'll
delivery
always
person.
fill our time, with, like, if you wanted to be a hobby, like, you're, not to encourage the alcoholism, but if you had you like mixology at home, like bartending for people, you can go bartend at a place for once, twice a month, or go, do something else that you would find interesting, anything but, the stuff that makes it stressful for you already.
Totally. And that's what keeps you balanced, for sure. Which is why I thought about being a flower delivery person, because I'm like, my work is really depressing. I really like if I knocked on someone's door and they were super happy to see me.
Because unfortunately, our work becomes our hobby sometimes.
It's true.
So.
Yeah. So lead a healthy life, feel well, live well. If I eat like crap, I feel like crap. You guys are probably the same. This is like universal, like health 101. Exercising increases endorphins, helps you feel better. So I love this one, keep a journal. I am not a journaler. Dr. Hawley, probably most of you know him. So he has kept a book of really good cases over the years. And when he's feeling really low, like, all I did last night was take care of drunks, or, whatever it is, that just kind of makes him feel like, why in the hell did I choose this profession? He goes to that little book and he's like, oh yeah, because I saved that little girl, 6 years ago, and, now she's in junior high and she's rocking life out. So he's got like this book of these good cases that helps him to feel good. I was asked in 2020 to do a year in review for something that I participate in, and just kind of what the year detailed for, like what it was for me, what did I learn, like what were my experiences for the year, and it was kind of a tough year because it was COVID. I actually had 5 different, I wouldn't call them all surgeries, but I was under anesthesia 5 times. I have a tumor in my face that keeps coming back. And it was a really rough year. I had to leave the state twice because no one could fix me here. Anyway, but when I sat down and I started writing, I just felt gratitude. Like I just felt like, oh my gosh, like look at that miracle. Look at the kindness that was shown to me, through the thick of my trials and my struggles. Look at how my personal community rallied around me. And so, maybe you're not a daily journaler. That's hard. Totally not me. But is there a way or a time that you can sit down and maybe put something to paper to really be able to, recognize some of the good in your life? All right, so good, better, best. I mean, I think there's a lot of things that can take up our time where we say, yeah. So again, you guys are learning way more about me than you ever wanted to know, but I'm addicted to political news. I know that sounds stupid. It drives my husband crazy. I'll sit and just watch the news like all day long, and it's usually because I'm like doing other stuff, and so sometimes it's just on in the background. But I would argue, maybe an hour or two is fine, but probably I have a problem, and it's probably too much of, one thing that I'm doing as like a coping. It's kind of mindless for me, but I feel like it connects me to what's going on. So other things that can be, maybe not great. If you're an exerciser, you can't exercise too much. It can become all-consuming. Even service can become all-consuming, to the point that you're kind of putting your family on the back burner. So these are maybe not healthy in moderation. And then replacing harmful coping skills. So does anyone know how President Reagan stopped smoking? I always love this story. Jelly beans. He took up jelly beans to stop smoking. So he had to replace the bad habit with something. I'm not saying take up jelly beans. Like my father-in-law stopped drinking soda pop because he got so many kidney stones. And then he took up Country Time lemonade, and then he got diabetes because it's sugary. So sometimes what you replace it with isn't the best thing either. So find good things. Anyway. So here's just some creative ways to kind of go about self-care. So there's a lot of resources. I actually have a couple handouts up here. So one of them just lists, and I know Will's going to talk about this. Sorry, I'm going to try to leave you enough time. So this is just a list of wellness resources. Some of these are local. Some of these are a little bit more maybe like on a national front. But when you leave, if you're interested in taking one of these, take them. If you feel like, hey, I kind of want to check into that. But I also just like some of these creative things. Like maybe you're not a cheesy person. I'm maybe a cheesy person. This might work for me. It may or may not work for you. I actually printed some of these out with a blank side. So if this is you and you want to do this or you want to implement this on your crew, then you can do that. But I kind of like that. Another kind of idea I had, and it's Valentine's Day. So I bought this several years ago. I haven't really used it, sadly. It's a year of date nights. Because after 25 years, you get kind of desperate to figure out what the heck to do. You can only go to Walmart so many times for your date, right? So anyway, maybe another idea, have a jar of like ideas of things that you can do when you're having a down day, something like that. So, all right, so how else can we check in with each other to make sure that our crews and everybody are good? What other options or what other ideas, I guess, do you have? Is it okay to just say something to somebody? Should you be offended when somebody says something to you?
Yeah, I think it's absolutely appropriate to check in on everybody.
Yeah.
I think unfortunately the default's gonna be, I'm okay, whether they are or not, and we've seen it.
How do we make that not the default?
I have no idea.
Yeah, so maybe recognizing that it's a choice, that you can open up, that you're in a comfortable atmosphere. So I actually was thinking about this too, and I was thinking back to when I was on the ambulance a long time ago. So I had a partner. We used to call him Angry Barber. Pat probably knows. Anyone else know Steve?
Oh, yeah.
Yeah. And he wasn't a healthy guy. And he ended up committing suicide. And I don't know how long, like when that was, but I think I was out of state when that happened, sadly. But we call him Angry Barber. I worked with him in Provo at a station down there, and we'd always joke around about how we were going to put him on a backboard and take him up to the state hospital, which is not too far, and tell him that he said he works as the paramedic, but he's really a psych patient that we were supposed to be bringing. I mean, like we just gave him so much crap. Every time we were on shift, it seemed like we were going over to Smith's to get some sort of cold medicine. Like he was constantly sick. Sick probably because he wasn't in a good place mentally, but we talked just briefly about how that can kind of translate into real physical sickness as well. And And when I think back, you know, it kind of makes me wonder, you know, could we have been a better crew to talk to him about what some of his life struggles were, you know, when he was having marital problems, when he was having, you know, some of those things, to really kind of intervene and have a more open crew about talking about some of these things. And I mean, I can't fix that now, you know, so now is the time, you know, so recognizing some of your own behaviors towards people on your team. I mean, it's, my husband used to call it grab ass, you know, like that's, like you joke with each other, you give crap to each other, sometimes in a loving way, sometimes not so much. And so just being aware of your own communications. Yeah.
Doc, I think we have to remember, and this kind of goes to what Corey said, is we might recognize in our partner something's wrong, something's off, right? Whatever it is they're going through. And we can ask over and over and over again, hey, you okay? I'm fine, I'm fine, I'm fine, I'm fine. At some point, there's nothing else you can do to help them, right? They have to be willing to help themselves. So that comes back to this, right? If you circle back around to your own mental health, you want to help this person, but there's only so far you can go, right?
So I like throwing parties. And I had a friend several years back. I know, sorry. I'll invite you next time. So I had a friend who would always call ahead of time and she'd say, hey, do you need any help? Hey, do you need anything? And I'm always like, no, I'm good. Because that's what we do. I'm good. She would just come over, like unannounced. She would just come over. She'd bring food. She'd help me. What do you need? Oh, you need your bathroom cleaned because people are coming over. You haven't cleaned your bathroom in a week? Sweet. I'll clean your bathroom. I mean, like, she was amazing. She would just come in and take over. So sometimes we recognize that there's a need in somebody and we can ask them, and that's one way to go about it. But I think another way is to just say, hey, I feel like they might need something. And so rather than, you know, sparking a conversation, you say, hey, what are you doing tomorrow night? Let's go catch a comedy show. My husband and I went to a comedy show a couple weeks ago. So fun. I love going to those because laughing is just super therapeutic. So, you know, find something to do. Hey, let's go get lunch. You know, let's go fishing, whatever it is that you like to do. So maybe if you're finding that, you got to think outside the box and figure out a different way to kind of connect with that person, and maybe get them to open up. And maybe when they're in their work atmosphere, you know, they've got their wall up, but maybe when they're fishing, you know, they're, you know, and it's more one-on-one, they're going to be more willing to talk with you and open up. So.
Dr. Grace.
Yep.
I think too, like, going back to like, how do we get that answer of, no, I'm just fine, to change it to like how they're really feeling. I feel like I've had some pretty good success with coworkers in the past with, you know, like after a hard call, instead of just like, hey, you good, cool, is, you know, because they're going to tell you, yeah, I'm fine, is to talk about your own issues with what's going on and open up there, because I think we all have that mentality of, I'm tough, I'm fine, I'm a firefighter,
Yeah.
it's part of the job, I'm good. And when you hear somebody else kind of chime in with, you know, actually I'm kind of struggling with this aspect of that call, then it kind of brings in good conversation of, you know, actually, yeah, that kind of bothered me a little bit, or, you know, kind of opening up ourselves to these people that are struggling can create good conversations.
So just another thought, I like that, thank you. Another thought, so when you are training and you're learning all your DCAT, BTLS and that kind of thing, what kind of questions are you asking patients? Can you think of, like, there's a term, this is a read my mind.
Closed loop kind of stuff.
Open-ended.
Open-ended, thank you, good job. Are you married?
Nope.
Oh, you're gonna do awesome.
I'm just a lucky kid.
So open-ended questions. So if you say, are you fine? You're gonna get a yes or no response. If you ask an open-ended question, that's gonna leave a lot more opportunity for someone to really open up to you, right? I mean, this is what we learned from the infancy of our career. So just a thought there. All right, so critical incident stress debriefing. Here I don't know, I think the M is just management. This is back to that 2012 CDC study where they look at that form of processing calls and traumas in the hope to prevent PTSD versus an employee, what's it called? It's on my next slide. assistance program, sheesh. And I like it. I mean, we know that these work. If you look at those numbers, these work. But there's certain ways that you have to do a debriefing. You know, it needs to be in the first 72 hours. They talk about how it shouldn't be mandatory. Not everyone's going to feel like opening up. You need to have somebody there who's kind of an unbiased person to sort of mediate or moderate the talk and the debriefing. So there's ways to do that, and I'm sure that you guys are doing this. It's always good to kind of revisit and say, you know, are we doing this the best that we can? Is there any way that we can improve these sorts of things? Because again, we know that they work. Is this what you're going to be talking about?
Just the option of.
Okay. So these are nice. They do provide a lot of good resources. Sometimes they are finite, like what you're saying, you know, I mean, you might only have 6 visits that you can go where it's totally paid for, and so there are for sure limitations, but this is an awesome resource if you need it. So like I said, I've got a list of resources up here. There's also a couple things. I actually downloaded this one just to kind of check it out. This one's called Crew Care, and it's on my list of resources, but it's just it talks about it's time to thrive, resiliency in the palm of your hand, and it goes through a bunch of questions. So it's pretty interactive and can help you kind of, you know, we talked about step 1 is kind of realizing some of these problems in yourself and then knowing how to combat them. There's another one called Responder Strong, and so it just gives a bunch of information about that. So you're welcome to take those too. Has anyone used any of these where you feel like, yeah, I've used this, I feel like this was super helpful? Not really?
Yeah, here.
Well, any of them. Any resources that you've used to kind of help you process a call. I mean, everyone's done debriefings, I'm sure. But any of the other like outside resources, whether it's EAP, you know, that someone feels comfortable sharing? Not really?
Participated in CISD thing multiple times, and for me, it never made a noticeable difference. I still had to go through.
Process it on your own.
Is how I think weeks later, months later, I'll get nightmares, and I notice like it's kind of the same steps I go through every time, regardless of whether I have CISD. So
Okay.
for me, it wasn't beneficial, but.
Have you learned, I mean, I guess when I talk to patients about like counseling or therapy and things like that, now a lot of the purpose of these is, you know, CISD is to process kind of what happened, you know, but therapy and counseling, you know, even though the resources are finite, you know, you might only have 6 visits, kind of the point of it is to give you coping skills, you know, so how do you process this? So it might be, what is it, narrative, like where you picture yourself on the beach, you know, so you put yourself outside of yourself, you know, you're kind of imaging or imagining yourself in a different situation to kind of alleviate stress, or different breathing techniques or things like that. So a lot of times they can give you techniques and things that you can employ even after your services are technically over, so that when you do start having nightmares or you do start having whatever it is, then you know what to do. Anyway.
I honestly also think that in a lot of, at least the few that I've attended over the years, the critical incident stress debriefings, I think they're just hastily and improperly put together. In my opinion, I don't think it was, this is just my opinion, but I don't think someone in a position of authority or who should be leading it, I think sometimes they feel the responsibility to put it together and be there to attend, you know, but, and maybe they need it too, but maybe they should have it amongst, you know, their own leadership. But in a lot of ways, it's very difficult for subordinates to be there and know that my captain or my assistant chief or my chief even is in the room, and that's very uncomfortable. Whereas someone that might have been, and I don't think they see that sometimes. I think it should just be more of equals. But I feel like some.
And you could probably do that too. But so why is it uncomfortable? Because you feel like you can't bring up criticisms maybe of how things were run? I mean, do you think that's why?
It could be a myriad of things. It could be, maybe this person might think, oh, maybe they don't get along with their boss to begin with, and now I'm gonna show some type of weakness, or maybe my evaluation wasn't very good last time, and therefore I don't wanna share anything, you know, that could open myself up, or it could be any number of things, or maybe they don't like that person's leadership, and if I actually say something that might allude to their leadership was bad in this event, it doesn't, it could be a myriad of things, and that, but
Sure.
when you have when it's just among your peers and there isn't anyone that's responsible to be over you, I think it's a little easier. I've seen it before in the past, and I haven't attended one for years, but I've seen some in the past where subordinates are like, I'm not gonna say anything in front of that guy because he was part of the problem.
So how do you get around that? I mean, so there's the problem, but what's the
You have
solution
to-
to that?
Unfortunately,
What do
you
you
have to, and I know that some of the leaders, they want to be there because they wanna, first of all, provide it. It might be just because, oh, this is a loop I have to jump through and I have to provide it. Or it could be the fact that they wanna feel like it's part of their leadership thing and it's more for them. They have to step outside of that, in my opinion, and leave it to just the subordinates, just the team members. Now, that's not to say that the leader that was there doesn't have stress and he could talk around, you know, but maybe it could be in a different format, separate.
Well, and so, I mean,
Does that
you
make
have
sense?
crew captains, yeah?
Because you have to think of the needs
Could
of
you
the
do
men.
that? Could you do that in your crew? I mean, if you're not feeling like those needs are met, I mean, ultimately it'd be nice if we fixed, you know, from the top down. But if that's not an option, can you process it in a different way?
Yeah.
You know, and do it amongst yourselves when you're on your crew. Because you're a little bit more tight knit, you probably feel more comfortable talking about things like that amongst your peers that you literally live with like for half of your life. Yeah, okay. So there actually surprisingly are some benefits of stress. So I try to help patients understand this too. Like, it's normal to feel stress. It's actually a good thing that we feel stress and anxiety sometimes. Because if you were running from a bear or whatever this says, a saber-toothed cat, you know, you want your stress, fight or flight reflex to kick in. You want all of a sudden blood pump into your muscles. You know, you want your heart rate to raise, your blood pressure to raise so that you can run away. These are all the same things that happen when you have just a normal anxiety or stress response. Our heart rate increases, our blood pressure goes up. These are normal things. But the hard thing is that sometimes when we're under too much stress, these things happen at an unnatural time. And so that's essentially what stress and anxiety is. But if we let it, stress can improve our physical performance in short bursts. So we're going to talk about that really quick. So I had a case recently, probably you guys can relate, and we talk, you know, when we're talking about airways and stuff like that. I had an elderly patient brought in by another agency in pretty severe respiratory distress. And, you know, I couldn't get a good sat on him. BiPAP wasn't cutting it. He was kind of disoriented. He kept trying to pull off his BiPAP mask. He was going downhill pretty fast. So I made the decision to take his airway, which is really kind of a big decision. You know, they talk about it being a big decision, and until something goes wrong, you don't feel like it's a big decision. You're like, oh, I just put a tube in. It's totally fine. Well, I put a tube in, and like, soon as I put the tube in, his heart rate went from like 130, 70, 50, 30, crap, somebody pulled the epi, you know, and he coded. And then I had to go tell his wife we couldn't bring him back. That felt awful. I cried with his wife. I'm a crier, I will say. But that was hard. You know, she said to me, maybe we should have brought him in sooner. And in the back of my mind, I'm thinking, maybe I shouldn't have intubated him. Maybe I should have let him just try BiPAP a little bit longer. Maybe I should have given him ketamine. He was like almost 80. I'm like, I don't know, like ketamine. You know, like you do this, right? What if? You know, what if I had done that? What if I had done that? So I felt really stressed about it. And then I decided I was going to take my stress and be proactive about it. So I jumped into my resources and I was like, all right, peri-intubation arrest. Like, what is everyone else doing to prevent peri-intubation arrest? You know, should I have had push dose epi at the bedside? You know, so that when I saw his heart rate starting to come down, I could have just given him a little hit of epi. You know, so then I didn't really find anything great. I was kind of dissatisfied. So then I started talking to my peers about it, and I was like, hey, I had this really crappy case the other day. I'm just feeling really crappy about it still. Like, I just feel like I made the wrong choice, and it just doesn't feel good. And they said, oh yeah, that happened to me. I remember when that happened. It doesn't feel good, but you did the right thing. They didn't really have any great feedback for me. They had nothing to say, oh, I do this, and that's what I was looking for. What do you do? But they also made me feel better about it, because it's like, he was gonna die if you didn't intubate him, and they were right. The guy was circling the drain. Maybe I expedited his death and made him not air hungry for a little bit longer, and that was kind and more humane. I don't know. I'll always wonder.
That's exactly what I was gonna tell you. I said, the writing was on the wall. It sounds like he was going to expire anyways, and I think honestly, in those certain circumstances, you gave him a peaceful way of going.
Sure.
So,
But it's hard. We
But it's
play
hard.
these what if
You don't
games. You know what I
perceive it
mean?
that way.
So if you turn that stress, anxiety, worry, whatever you want to call it, and you let it propel you to learning more, to being a better provider because you learn from your experience, then cool. We can turn it into a good experience. Okay, so increased job satisfaction. So having a leadership role. So down here on the bottom, lack of control kind of helps us, well, it doesn't help us, but it makes us feel not as satisfied with our job. If we feel like we have superiors who aren't listening to us, or we don't have a voice, it doesn't matter what we think, then we don't say anything, like Pat said, we don't participate, we're worried about the repercussions of trying to be involved. But if you're in a leadership role, it does give you some control. You feel like maybe you're helping other people. So that can increase satisfaction. If you're getting paid fairly, that's obviously going to make you feel a little bit more satisfied with your job. Teaching or consulting, I love this. Be an expert. Whether it's in your department, in your crew, be an expert. Be the person that people come to for a difficult airway. Be that guy or girl. I like this sense of belonging, not just fitting in. So fitting in is changing yourself to fit in with a group. Belonging is really kind of the opposite. It's the group encompassing you and helping you to fit in, not by changing who you are, but by seeing the value in the differences sometimes, and I like that. I'm almost done. So I like this. I actually have some positive affirmation sorts of signs in my house. I have one that says love God, love people, because my mantra at work too often is I hate people. And so it's like a constant reminder, okay, you gotta love people. There's a reason we went into this job. It's because we wanted to help people. I think most of us genuinely, on a good day, like helping people. We like people. We're people. Maybe some of you aren't, but most of us probably are. I have another one that says, you're making a difference every day. I need those in my life because, anyway, I just need little reminders. So if you're that person, find some little things, put them up, whether it's at the station or on your mirror, whatever. So you guys have a lot to be proud of. These are some of your stats. This is your annual call volume. You guys have been busy. You saw 7,700 something patients in 2021. So this is your 2022 report from 2021. Your response times are awesome. You're giving to the community, you're participating, you're reaching out, you're doing all these things. So I think in general, your community is thrilled to have you. I love seeing all of the, thank you responders. There's been so much of that since COVID. I was at the Columbia Outlet buying a jacket or some ski pants, a couple months ago. And they had a 10% discount for EMS and police, and it was public safety. And I was like, heck yes. I am a paramedic. I am a really cheap, no, anyway. But it felt good. I felt like these guys want to say thanks. And that gave me $10 off or whatever it was, So that was super cool. There are actually a lot of companies that do that. And really, if you recognize, they're doing that because they appreciate you. They value the work that you do. And I love this. And as someone who lives in your catchment area, I say thank you. So anyway, that's all. Anyone have any other thoughts? No? Okay. Guess Will's up. Sorry, I went a little bit over. I don't know how long this was.
Thanks for speaking, it's great. All right, so I just got asked by Roxanne here before this started. So just to remind everybody, we have a peer support system in place here. Okay, so some of the people that are on our peer support, I'm naming them off. And the idea behind this is we have a diverse group of people on the peer support network, so that you can go to somebody who you feel comfortable with, somebody who you feel like maybe you can relate to, that is gonna match your energy, your personality, or whatever you need at that moment, right? It might not be the same person all the time. So for when you have these difficult calls, or when you need to just talk, have somebody listen. That's what we wanna do, is just listen. And we wanna help you in any way we can by offering you resources. So we have quite a few resources we can kind of direct and help. And if you really are having that hard time, you're like, you know what, I don't feel like I'm gonna make it to tomorrow, and I might hurt myself, or I might hurt others. Okay, that's a great option, and you don't feel comfortable like calling 911 and saying, hey, guess what? You know, because you don't wanna end up in that hallway at Davis, right? Which is scary, I think, for a lot of us, that it's like, I don't wanna be that guy, I don't wanna be that patient. And that's hard, I think, to work through for some of us. I think there's that. Anyway, I certainly don't want to be, and I know I've needed help, and I certainly reached out to people, and it's been helpful. But some of the people that are on the crew here, well, the list that I have, the current list, this is from the last email that was sent out by Kelsey. Kelsey and Nate are kind of the people over this whole thing. So Kelsey, Nate, Brent, Kyle, Corey, Mikkel, David, Allison, Ashton, Kaylee, Garrett, Micaiah, myself, and Adam Smith. So we have plenty of people on our crew. If you'd like to reach out to other people from the other crews, feel free. That's what we're here for. If anything, just listen. So if you don't have our numbers and you'd like to talk to somebody, you're more than welcome to reach out to me. I'll give you their number, or ask somebody who might have it, and that'd be just fine. You'll notice on here we have engineers, and we have captains, and we have firefighters, right? So if you don't feel comfortable talking to a captain because, like Pat said, maybe there's like hey, I don't want this to affect anything, or I don't want them to know, you know, reach out to another firefighter. The captain doesn't feel comfortable talking to a firefighter about something, he talk to another captain. You know what I mean? It's whatever you feel comfortable with, and it's completely, excuse me, I just lost the word.
Confidential.
Thank you, confidential, completely confidential. In fact, it is illegal by law. There is a law for this whole thing. It is illegal for us to breach that confidentiality. So just understand you are protected by law, but if you have issues or concerns and you want to talk to somebody, okay, that's us. Like I say, we can help direct you to EAP or other specialized resources that we have available to us. So do we have any questions about your support stuff? All we got.
Cool. Awesome, thank you. Thank you, Dr. Grace. Thank you very much. Thanks, Lil. I know that was short. I know Kelsey's got a flyer that she had somebody make up that we're gonna put in the bathroom stalls. Hopefully, I'll get that out. We'll get that out in this next week. Thanks, guys. Your boss isn't here today, so there's anything else. Is that?
Even when he's here, he's not here. So.
That's not true, he is. Cool. Thank you, guys. Appreciate it. Have a good lunch. Be safe out there.
Don't forget, there's handouts up front if you want to take them. Don't feel obligated, but if you feel like it would be helpful, please take.
I'm gonna try that thing. New one of those. Got something. Hey.
Ready for this?